Hi, my name is Dr. Michael Veselak, and today I'm going to talk about spinal stenosis and how brain-based therapy, nutritional, and metabolic testing can help our patients that experience symptoms from spinal stenosis, disc herniations, and disc bulges. So some of the common symptoms of spinal stenosis are back and or neck pain. Your legs or arms can ache, usually following prolonged standing or walking. You can have burning pain, numbness. You can have weakness, atrophy, fatigue, stiffness, and oftentimes you're have an inability to do the task that you're used to performing on a regular basis. So there's a lot of treatments for spinal stenosis that have been around for a long time. Most of you have already realized they're not very effective because they're not a comprehensive approach. You might have tried physical therapy and they've done exercise, stretches, and or weights. Sometimes you've tried a course of epidurals, and then usually you need another round of epidurals. Surgery as far as laminectomy or fusions have been tried with patients. And then sometimes you've tried chiropractic. Well, what we're here to tell you today is we offer a very unique, specific approach to the treatment of spinal stenosis that have proven very effective for a lot of our patients. So statistics show that 1 in 100 low back surgeries are successful in relieving spinal stenosis pain. 1 in 100. Most surgeries take place again within 1 to 5 years. And so if the epidural works the first time, the brain, the body gets used to it, and it usually doesn't work a second time. Most of our patients have already been to 6, 8, 10 places, have tried the course epidurals. Some of them have tried the surgery, and we still have great success with helping these patients with their symptoms of spinal stenosis. So here's a side view of spinal stenosis. So here's the vertebra, the disc here. This is your nerve, spinal cord coming through, and you can see right in this area it's kind of a little bit narrowed. The narrowing is what they call lumbar stenosis. Here's another picture of it. This is showing you a herniated disc. The bulge right here puts pressure on the cord coming down, and again it's narrowed right there. That's the stenosis. So when we're looking at an MRI, we're looking to see what level the stenosis is and does it correlate with our exam findings. So give you a little anatomy lesson. In between each vertebra there is a normal disc which should be a certain height. And when the disc degenerates, which is kind of the normal process of aging, the disc will start to shrink a little bit as it loses water. When we see an MRI or an X-ray, we look for a degenerative disc, and you can see how the black right here, we call that a vacuum phenomena. That is when they're starting to get air within the disc from the degeneration. A herniated disc is when the contents of the disc actually squirt out into the canal, where a bulge is where it's still self-contained bulge within the canal, still compromising the size of the canal where your nerves come out. Now the sciatic nerve actually comes from these two levels, L4, L5, and that's usually the most common causes of the most common area where there's spinal stenosis and or disc degeneration. This picture here kind of shows you where a degenerative disc right at L5, a spur, an osteophyte coming out, again putting pressure in that canal, reducing the size of that canal. So here's an MRI. Most of you have already had an MRI of your spine. This is the side view. The white is your spinal cord. This area is your disc. This white here, this is a healthy disc. And you can see the black is more, the water is starting to leave, becoming a little degenerative. And as we go farther down, it's a little bit more narrow here. We have a disc bulge, and then a big disc bulge here that's creating the stenotic feature, in these two areas. So this is a stenosis of, here's L5, L4, stenosis of the L4 region. What we've seen in our clinic is there's always a common thread to all chronic health conditions, and stenosis is definitely one of them. Early in my career, when I started looking at MRIs, I'd see an MRI that of a patient that had complete degenerative disc disease, stenosis throughout their vertebra, but they would have no symptoms. And then I would have another patient, their MRI wouldn't look as bad. They would have a lot of stenosis symptoms, and I was thinking, well, if the disc bulge and the osteophyte and the degeneration cause the stenosis, why is it not 100%? And the bottom line is there is an inflammatory metabolic component that creates the pain and the state of inflammation in the area that creates a lot of the symptoms. So with our stenosis patients, your symptoms, you can see a lot of these symptoms: sciatica, diabetes, thyroid conditions, fibromyalgia. There is always a metabolic component, and that metabolic component can be, well, it is different for every patient. It could be anemia, it could be high glucose, it could be hormone imbalance, food sensitivities, autoimmunity, infections, sometimes just low oxygen levels. There are a lot of different causes, as well as that will eventually lead to a neurological imbalance or a decrease in the frequency of firing of the nerves. So some common underlying causes that we've seen in our office of spinal stenosis are, number one, a weak cerebellar output. The cerebellum is a part of our brain that controls our balance, our posture, and muscle coordination. So the stenosis patient, they start to lose the curve of the lower back. So that's our posture. And we start to get that forward lean, that bent over position, where when you go to the market, pushing that shopping cart tends to feel better. Common, we see a low oxygen input with these folks, and insulin resistance and or diabetic problems. Oftentimes it could just be simple sprain, strain that can actually create the inflammation. Sometimes disc herniation. There's a lot of different causes to the spinal stenosis. So in our office, there's always like a combination, and what we usually see is with stenosis is 60% neurologic, 40% metabolic. Now, that's not for everybody. It can be 80-20, 70-30, but with every single stenosis patient, there is an underlying metabolic component. So the nervous system basically controls everything in our body. At Gray's Anatomy, it says, the nervous system controls and coordinates all the systems of the body and relates the individual to their environment. So our brain, again, the cerebellum, is the part of our brain that controls posture, balance, muscle coordination, and muscle tone. There can be different chemical and physical stresses to the brain, and there's a lot of different causes of these. Anemia, blood sugar, food sensitivities, immune imbalance, poor diet. You can have hypothyroid. Sometimes your prescription medications can create this physical and chemical stress to the body. Infections in the gut. So these are some of the metabolic problems that can create the nervous system to not function properly, to cause that cerebellum, that input, to start to create that inflammation, flatten that curve out, give us that forward lean, create that stenosis. Sometimes the problems are not always physical, they could be emotional. Our adrenal glands release cortisol, epinephrine, and that could be emotional stress and or sometimes insulin can create some emotional and some chemical stress to the body. So what we do in our office is a little bit different, as I said. We not only look at the structural component, the narrowing of that canal, the disc degeneration, the alignment of the spine, the function of the vertebra and the nerves, but we also look at the metabolic, the underlying thread, the chronicity, the inflammation, as well as we do neurological tests to determine how the brain is functioning. How is that cerebellum functioning? Do we need to give exercise specifically to the cerebellum to help with the balance and posture control? We do a very specific set of exercise called center of pressure that we've seen great changes with the curves, as well as the therapies that I'll get into in a bit that we do to promote the curve in the body to increase that canal space, decrease the inflammation. So The cerebellum and brain require two things to function properly. They require fuel in the form of glucose and oxygen, and activation. And activation is basically, the brain is a muscle. And the brain, remember, controls the posture. It controls that forward lean. You can change that through giving the brain different exercise which stimulates it to, it's like a muscle. The more you work it, the better it gets. So when I went to school, we didn't know about the concept of neuroplasticity. In the early 1980s, they discovered that given the right exercise, the brain can change. So we use oxygen therapy in our office. It's called EWOT therapy, exercise with oxygen therapy. And oxygen is, again, one of the things we need to survive, oxygen and glucose. And it does a lot of things. It helps improve brain activity, endurance, strength. And just by the oxygen therapy alone, people start to feel better. It allows their body to become less inflamed, to start to heal. And then we give a lot of things to activate. Fuel and activation. Fuel is glucose and oxygen. Activation is exercise specific to that patient to bring that dysfunction back wherever that is in the body. So we'll use manipulative or mobilization techniques. We'll do the oxygen therapy, sometimes vibration therapy. At times we'll do different visual or sound therapy, different things to stimulate that part of the brain that has started to create a little bit of dysfunction, which creates this whole cascade effect through the body. So this is one of the exercise with oxygen therapy. The magnetizer, we have two in our office with the oxygen, so you can see here a patient, she's just doing a little EWOT therapy prior to her different therapies we do. So I talk about metabolic component, and metabolic, it's a word we hear, but we're not really sure what it means. A metabolism basically means when you eat food, you get energy. And our nervous system is basically our greatest consumer of energy. 30% of the body's energy goes into the nervous system. And if it doesn't have quite the fuel and the activation from our good metabolism, then we'll have nerves start to degenerate and inflammatory process will start. So we all know we need proper glucose, and those of us that are watching this DVD, if you have glucose issues, either insulin resistance or diabetes or hypoglycemia, you'll know that if you don't eat properly, you'll get like a little brain fog, or you just don't feel right. Well, that's poor blood sugar will basically equate to a bad brain. You'll be in this brain fog, can't remember kind of where you put your keys or what you did yesterday. So there's a lot of different metabolic disorders that can create this imbalance. I've mentioned a few of them: the anemia, the blood sugar, the autoimmunity, gut infections, food sensitivities, sometimes adrenal or thyroid dysfunction. There's a lot of causes. So what we like to do in our office is when we treat a stenosis patient, we treat the whole person. We look at what that underlying metabolic component is that's driving the inflammatory process, and why this patient is having such trouble with that stenosis as opposed to the other patient that has stenosis but has no issues. So how do we do that? Well, when you come in, I ask you to bring in your lab work so I can go over them. And if you've had lab work within the last 6 months, that should be suitable enough for us to determine where the inflammatory process is starting. And then we'll give natural, support when needed, or if we think you need medication, we'll recommend you go back to your doctor and talk about that. And so we do the proper testing to determine where the inflammation is coming from. So a lot of times we'll have a patient come in here and they go, "Oh, my labs are good. I just got my labs, my doctor says they're perfect." Well, what we do in our office is we look at them a little bit differently. We do what they call functional lab testing and functional medicine. And that is, we take normal lab values, we just tighten the values up just a little bit so we can look at patterns. And oftentimes when we see a pattern that's not working right, that could be the underlying cause when you've been told your labs are normal, why you're having pain when you go walk through Costco and all of a sudden your legs start to burn. So The functional lab ranges are this little area between the abnormal low and abnormal high. So if you already have high or low ranges, it means you already have issues. What we're looking for is things prior to becoming high or low before they become real issues in your body. So it's still creating problems of an inflammatory reaction, but you're not really lab range high or low. So for instance, glucose. Our ranges are 85 to 100. The lab ranges are 65 to 110. And I guarantee you, if I have a patient that has a glucose of 82, which is well within the range of the traditional lab ranges, they are already having hypoglycemic type symptoms. They need to eat frequently, or they get spaced out, or they get jittery, or they just get in this brain fog if they don't eat. So these patients usually have already figured this out. They pack snacks in their purse or their car, and they eat on a regular basis because they know if their blood sugar drops, they're not going to feel so good. So based on your history test, we might recommend a few other labs. So we'll look at your complete blood chemistry. Sometimes if we feel like from looking at these labs that you have a hidden infection, we might recommend a stool or a saliva test to look at the adrenals closer. Most of the time, though, the labs that you have are sufficient enough for us to look at what is driving the inflammatory process in your body. We use a very specialized lab called Cyrex. If we really want to dig deep, if some patients have these deeper issues, we can do this type of testing to really pinpoint exactly what the cause is. So functional medicine is, again, taking these lab values, looking at patterns, and more importantly, getting to the root cause and then supporting the body through natural means to get the body to heal itself. In our office, we use a lot of very advanced structural treatments also. I mean, with stenosis, because it is definitely a structural problem as well, we address it obviously from a structural standpoint as well as the metabolic and neurologic. So we'll use different treatments for spinal herniated disc or bulges. We'll restore the normal function of the spine, and we do this through a process called spinal decompression. We have 3 different decompression type tables in our office, and depending on what we determine at the time of our exam what would be most effective for that patient. And what decompression does, it basically brings nutrients back to that disc to help it heal, and it just ever so slightly increases that disc space to increase the canal size to allow a little bit more breathing room for those nerves that are getting pinched there. So as I stated, it kind of promotes healing from inside, creating that vacuum, increasing the size, and putting more fluids and nutrients back into the disc. So when we use our decompression with our neurological exercises, which help to stimulate that cerebellum, we've had tremendous success with our stenosis patients. Now, for years, I'll be honest, stenosis was the most frustrating thing to treat, as you've probably already experienced with other practitioners. It's really difficult to improve a patient. Now, our treatment now, I have to say our success rate is over 90%. So we treat it metabolically, where we decrease the inflammation, neurologically, so we get the right nerve flow to the area to help it heal, and then structurally to increase that space to eliminate the pressure that's creating the stenosis. So this is basically what makes our office different from every other doctor. We treat patients neurologically as well as metabolically. And I'm here to tell you that we leave no stone unturned. If we need to run labs, we're going to run labs. We are going to get to the root cause of the problem, and when we do, you're going to improve. So we take all these different issues that might be going on with a patient, and then slowly we start to work on the whole person, and then eventually things normalize and patients are feeling a lot better. Now, how long does this take? Well, it varies from each person. With our spinal decompression, it usually is a good 3 to 6 month protocol. Stenosis is such a chronic degenerative condition. It took so long for that condition to develop, and And it just creeps up on you. One day, all of a sudden, you're like having a little intermittent pain, and then before you know it, you're having trouble standing or walking for periods longer than 10 minutes. So it creeps up slowly, and it does take us time to make that structural and metabolic change within that patient. So what's next? Well, make an appointment. You know, if you've watched this DVD and if it makes sense, if our approach makes sense to you, then make an appointment. On the first visit, we're going to do a complete evaluation of you musculoskeletally, as well as a very comprehensive neurological exam. We're going to review lab work so we can determine what the root cause is, and then we're going to provide you with a treatment plan that we'll go over on the second visit. We recommend that you bring a significant other or your spouse at the time of the exam, so when you leave and you don't remember everything we've told you, that person can help you with deciphering some of that information. We try to give it in a very clear and concise manner so there's an answer to all your questions we can to make you feel comfortable when you make a decision to start treatment in our office. We run a very busy clinic. Like I said, we're usually a patient's last stop. They've been to several different clinics before they come here, and we treat a lot of different chronic health conditions like peripheral neuropathy and the stenosis and chronic pain, fibromyalgia. So I kind of limit each niche to 5 new patients a month, that's all. So if you are interested, schedule an appointment after watching these DVD. Our initial exam usually runs $450, and if you decide to come in from this DVD, we'll charge you, $50 for the 2 visits, and then give you a clear and concise method to help relieve you from this stenosis. So I do request a few things, and I tell my patients that if you decide to come to my office for treatment, I need you to commit to a few things. 1, you must be willing to make serious life changes. So I'm going to ask you to make certain dietary and lifestyle changes, and you're going to need to take these seriously. Secondly, you have to take accountability for your own health. You can't blame anything, anybody. This is you, and you need to take responsibility for that. Third, Medicare or your insurance will cover a small portion of this care, and we will verify your insurance, tell you what that portion is, but there will usually be an out-of-pocket expense because they don't cover all the treatments that we do. And generally, your treatment can run between $150 to $300 per month. We do offer plans that have 18-month free interest-free financing, if that's reasonable. We'll go over costs and different options you have at the time of your visits. So what I want you to think about, though, is on a scale of 1 through 10, how has this affected your lifestyle? And if you had 3 things that you would like to do but can't do because of the stenosis, what would those 3 things be? Is it to travel more, to spend more time with your grandkids, to just even walk around the block without having the pain? So I'm really looking for the patients that are serious about getting better. Like I said, we only accept a certain number of spinal stenosis patients per month, and we are really interested in the people that are looking to improve themselves. The treatment that we provide is comprehensive, and more importantly, it's effective.